Hi there! Today we're going to give you the Medicare 2023 basics in under 5 minutes. But before we dive in and before we start that clock, please make sure to subscribe to stay up to date. And of course, click that like button so that we can get this information out there. Really, just clicking that like helps YouTube promote this video so much more so that we can get this information to those who are looking for this type of information. And of course, if you have any questions whatsoever, or if you'd like to give us some feedback about your Medicare experience, we would love to hear from you in the comments below. And you can always reach us at the number on the screen with any questions you may have. There is, of course, absolutely no charge for our services. All right, let's start that clock. So when you first turn 65, you will become eligible for Original Medicare, which is Part A and Part B, and you'll likely be automatically enrolled and receive your card in the mail. Now, if you or your spouse has worked at least 40 quarters, which is about 10 years, then you will qualify for free Medicare Part A, so there won't be a premium. There is, however, a premium for Medicare Part B, and in 2023, the base premium is $164.90, but it can be more based upon your income. Together, Part A and Part B will comprise most of your medical needs. So Part A will help to cover inpatient care in a hospital, skilled nursing facility care, nursing home care like skilled nursing facilities, hospice care, and home health care. And then there's Part B, which will cover medically necessary services and preventative services. So these would be things like clinical research, ambulance services, durable medical equipment, mental health services, outpatient care, and limited outpatient prescription drugs. And basically any type of doctor's visit, diagnostic tests, or screenings. Now, Original Medicare does not cover dental, vision, hearing, or prescription drug. You'll also have copays and coinsurance and deductibles to meet, and there is no out-of-pocket maximum with Original Medicare alone. So that means if you have major medical needs, you could have some major medical bills, which is why many people look into a Medicare supplement plan. Now, supplement plans are also known as Medigap plans. You can enroll at any time during the year, but you're definitely going to want to do so when you first become eligible. So that's the 6-month window after you turn 65 and enroll in Medicare Part B. During this time, you won't be subject to medical underwriting. After that, you may be subject to medical underwriting, which means you could be denied or charged more. Now, although Medicare supplement plans will not offer additional benefits like dental, vision, hearing, and prescription drug, they will fill in the financial gaps. So they will help to largely cover or entirely eliminate deductibles, copays, and coinsurance. So yes, you'll pay an additional monthly premium, but your out-of-pocket costs will largely be taken care of. Then there are Part D plans, which will help to cover your prescription drugs. Now, many of your more basic prescription drugs will be covered before you meet your deductible, but the maximum deductible that you can have in 2023 is $505. After you reach that deductible, you'll enter into the initial coverage phase, and you will be responsible for copays dependent upon the tier of your medication. There are 5 tiers. Generally speaking, the higher the tier, the more expensive the medication. But those more regular medications tend to be tier 1, tier 2 anyway. Now, if you do take a lot of medications, or you have to take some of those more expensive specialty medications, if you continue to spend, you may reach the coverage gap, at which point your copays will increase. But if you spend further, you may reach the catastrophic coverage phase, at which point you'll only be responsible for 5% of the prescription's cost. This page on Medicare.gov is dedicated to the 4 stages of Part D. So over here, you will see the yearly deductible for drug plans. So the max deductible that any drug plan can charge is $505. Then if you were to click on this tab, you'll pull up copays and coinsurance. So basically, we're talking about the initial coverage phase at this point, and those are those 5 tiers of medication. As you can see here, the amount you pay will depend upon the tier level assigned to your drug. So generics will be less expensive, and then those specialty medications will be more expensive. Medicare will keep track of how much you are spending, and once you and your plan spend $4,660 combined on drugs, you'll move into the coverage gap. Now, at this point, you will pay no more than 25% of the actual prescription cost. You can see that here. And if you continue to spend, you will enter into catastrophic coverage, and that's once you and your drug plan have spent $7,400. And at that point, you will pay a small percentage, no more than 5% of the drug's actual cost. You can enroll in a Part D plan when you first become eligible for Medicare, or during the AEP, which is every year from October 15th to December 7th. The AEP is also a time to enroll in a Medicare Advantage plan. Now, Medicare Advantage plans are actually a replacement for Original Medicare. So if you go that route, you're going to forego Original Medicare entirely. They have to offer you at least the same benefits as Original Medicare, but they may offer additional benefits like dental, vision, hearing, and prescription drug. Medicare Advantage plans will work more like the health insurance that you've had in the past. So you can choose from HMOs and PPOs, and the flexibility and coverage is determined by the plan that you choose. Now that is something to take with a grain of salt, because yes, Medicare Advantage plans can be a great way to save money. They can offer you additional benefits, but those networks can be rather restrictive. So if you are going that route, make sure you work with a broker. So we did it in 5 minutes or less. Those are your Medicare basics. Now, of course, these are just the basics for 2023. So if you have more questions, you can absolutely reach us in the comments below, and we hope that you do. And of course, you can reach out to us via the number on the screen. We are licensed nationwide, and there is absolutely no charge for our services. So if you need help enrolling in a Part D plan, a Medicare supplement plan, or a Medicare Advantage plan, we are certainly more than happy to help. And like I said, there's absolutely no charge, and it is definitely a plus to have someone on your side when navigating the very complicated world of Medicare. But before you go, please make sure to hit that subscribe button, and yes, click that like button so we can get this information out there. As always, thank you so much for watching, and have a wonderful day. Bye-bye.